Okay, so we're going to run you through the protocol of a YMCA SubMax Test. So this is Olivia. She's going to be our participant in the study today. So Emily is first taking her resting blood pressure in order to have that documented for the process and just to make sure she's going to be at a safe blood pressure before starting the test. Something else to note is you're also going to want to get the patient's resting heart rate as well. So Olivia has a watch that calculates her resting heart rate, so we will make note of that for the test. So there are a couple of things an individual should know during the test, just in case they would need to stop it. So one of the main reasons you would first stop the test is obviously if the client asks you to stop the test, they're not comfortable, they feel like they need to stop, then they would stop the test. Another thing would be if the client fails to conform to the testing protocol, let's say they can't hold that RPM, they can't keep pedaling at the pace that's supposed to, then you would also stop the test. You would also stop if the heart rate goes greater than 85% of their age-predicted max heart rate. So in my case, if it were to go over 200, you would stop the test because I'm 20 years old.
Olivia is 22, so her max heart rate is 198.
Yes, so that's when we would stop the test for Olivia. Hi, Olivia. So there are a couple of things an individual should know during the test, just in case they would need to stop it. So one of the main reasons you would first stop the test is obviously if the client asks you to stop the test, they're not comfortable, they feel like they need to stop, then they would stop the test. Another thing would be if the client fails to conform to the testing protocol, let's say they can't hold that RPM, they can't keep pedaling at the pace that's supposed to, then you would also stop the test. You would also stop if the heart rate goes greater than 85% of their age-predicted max heart rate. So in my case, if it were to go over 200, you would stop the test because I'm 20 years old.
Olivia is 22, so her max heart rate is 198.
Yes, so that's when we would stop the test for Olivia. Hi, Olivia. Some other indications you should stop the exercise test is if they have signs of poor perfusion, like if they're lightheaded or if they start to look confused, or nausea, or even just cold and clammy skin. If they start to look sick, they probably are starting to feel sick. Another reason would be a noticeable change in heart rhythm, or just failure for the heart rate to increase with increased exercise intensity. You would as well, and especially for onset of like angina or angina-like symptoms. And then also a significant drop in systolic blood pressure or failure for it to rise, like I said, with the intensity. You would stop the test as well. Okay, so there are a couple things you need to do before the test. You have to set up your equipment. So this is the Monarch bike that we're going to be using for this test today. It's the standard bike used for this kind of test. So first we're going to make sure that the seat is at the same level of Olivia's hip. So it appears like it's, the greater trochanter. And then, so I'm going to actually move it up because Olivia has long legs. Right? Okay, so now it is at her hip level, so she'll be able to ride comfortably. So Olivia, you want to get on and try it and make sure it works for you? Yeah, you also don't want to be reaching too far for these, so we're going to move those up for her as well. Yes, it is. It is comfortable for her. Isn't that great? Okay, so that's how that'll be set. We're also going to let our participant know what the RPM is for this test. So Olivia, you're going to be doing 50 RPM, which is the revolutions per minute you'll be doing. So just when you bike, try to make sure you're at the same speed as 50 RPM. So you'll see it shift as you go faster or slower. If you want to try it out and get to 50, just see it for a second. Okay, great. So she's at about 50 RPM right now, so she's going to maintain that cadence throughout the test. So Olivia warmed up for a couple minutes before we started, and now we're going to start the timer. Is the timer started? Great, timer started. So each stage is going to be 3 minutes in duration, and the timing is going to be kind of critical because during each stage you're going to take 2 heart rates readings and 1 blood pressure reading. So she's starting her first stage now. So once the timer is started, you will add 0.5 kp of resistance. And so at 1 minute and 45 seconds, you'll take your first heart rate. How you doing? You feel okay?
Feel excellent.
What's your RPE at?
6.
So we just took her RPE, and in order for an RPE to be accurate, you do have to have the Borg scale held up for the client to be able to see it and accurately assess it. Okay. Dr. Franz, how are your chickens? Let me know.
Chicken day in the Franz household. 6 baby chicks.
6 baby chicks. Are you having fun yet?
You're doing great. Thank you for the support. Social support is important.
Bellarmine is a supportive and hospitable community. Okay, so we're coming up on 1 minute and 45 seconds. So Emily is going to take her first heart rate. She's also going to read her blood pressure once we hit like 2 minutes.
Heart rate is 85.
The first heart rate is 85.
Should I take her?
Yeah. So now she's going to take her blood pressure. Hopefully it's healthy. Okay, so now we're coming up on 2 minutes and 45 seconds, so I'm going to take the second heart rate and get RPE.
What is your RPE? 6.
Her RPE is 6.
How about yours?
Her heart rate is at 89.
Okay.
So now we're...
3 minutes, yeah.
Yeah, so now that we've hit the 3 minute mark, we are going to change the stages. Is her heart rate, what is that? 85. So her heart rate is within 6 beats of each other. So that means it, let's see. Yeah, we're going to move up to 100 watts and 2 kp.
We can't stop there. All right, that's 2.
Okay, so now we're at 2 kp.
Good. Okay, let's check her heart rate. Right?
Yep, so now we're going to take her heart rate again for this stage.
It's not moving at all.
So in order to determine the stage she was going to go in, we went ahead and looked at this chart, and hers fell between 85 and 89. So I followed this chart and we put it to 2 kp. Yeah, so she's going to be taking the blood pressure for this stage now. Now that we're coming up on minute 6. Olivia, what is your RPE?
We're good. Okay.
10. Her RPE is 10.
Her heart rate is at 107.
So the test will be complete when at least 2 consecutive stages are completed with steady state achieved in each stage. And both of those consecutive stages have to fall above 110 beats per minute. But it cannot be higher than their 85% predicted heart rate max.
Which is 168 for Olivia.
Yeah, so for Olivia it's 168, so we don't want to go over that. So far, no indications have arisen to stop the test as well. So we are starting the 3rd stage now because her heart rate's.
What does she go up to?
She'll be going up to 2.5 kp.
Okay.
So I can do that.
You're there.
First try.
I'm gonna take her.
So her heart rate was taken, and now she's going to be taking her blood pressure.
Oh my god, I didn't recognize you.
I can't get it.
Huh?
We could still be going at 5:45 when I get out.
Yeah, probably.
Okay, good.
We were gonna have you. What's your heart rate?
So we're taking her heart rate now for this stage, the 2nd one. And it's been the 3rd stage, and she has a heart rate of 133 beats per minute. So this would be the 1st stage where she's going over 110.
So next stage.
Yeah, so the next stage. So for her next workload, she's going to be doing 150 watts at 3 kp. So we're going to up this to 3. How are you feeling?
RPEs, did you get that?
So what was your
15. 15!
Oh my goodness. So that was her RPE for her 3rd stage. Now she's going to start taking the blood pressure and heart rate.
I can't even keep up with it.
You have to keep up with it, otherwise you have to stop the test. You can do it! It's also important to cheer on your participant. Go, Olivia! You look great.
Oh, thanks.
Did you get your hair done? Looks awesome.
Gee, thanks.
You're welcome. Maintain that cadence. So she's working at her cadence of 50. So Emily's taking that. Keep going. You can do it. You're almost there. We just need one more blood pressure. You can do it, Olivia. Keep going. You got it. You got it. Just keep maintaining. You're doing good. A little bit longer. Let her get this blood pressure and heart rate, and then we're good because we're going to hit it. Okay, stop. Okay. So we have her last one, but now we're going to conduct a 3-minute cool down, and then we'll take vitals once more to make sure she's cooled down appropriately. So I'm going to pull this KP down, and you go ahead and just keep biking for a little cool down. So I'm sorry. Okay. We're good? You got water. You can have some water. Which one's your water bottle?
The cup right there?
Yes.
Nope.
The Yeti. Product placement. It's a Yeti. Okay. You done?
There's no more water in it.
Oh no. Okay. So now she's doing her 3-minute cool down, and then Emily will take her vitals at the end to make sure she was kind of cooling down appropriately and that she's safe. How does her heart rate look?
Heart rate's going down.
Heart rate's coming down. Okay. So her blood pressure has been recorded.
It's going down too.
It's going down.
Yeah.
Great. So she's declining steadily and safely in her vitals.
Yeah, no, we're good.
So she's participating in kind of an active cool down by continuing to bike, but she's biking at no KP, and she's biking at a pace that's comfortable for her to slow down doing.
Yeah, okay. She's reached 3 minutes. Hold on.
Okay, so she's doing her 3 minutes. What does the timer say?
You're at 15, you're good.
Okay, she's good to stop. So the test is going to be ended, and that's it.
Yeah, bye.
At the end of the first stage, Olivia's heart rate was 89 beats per minute. Therefore, we started her in this column and set her workloads accordingly. During the third and fourth stages is when Olivia reached 2 consecutive stages where she reached steady state heart rates that fell within 110 to 150 beats per minute. So during stage 3, her ending heart rate was 128 beats per minute at a workload of 750. So I'm going to plot that right here. And during the fourth stage, she reached 144 beats per minute at a workload of 900. So I plot that right here. Olivia is 22 years old, so her age predicted max heart rate is 198 beats per minute. So I will make a line right at 198 beats per minute. So now I have a line across at her age predicted max heart rate, and I have her 2 dots where she reached steady state. And I will now connect these, and I will make it intersect her age predicted max heart rate line. Now that I've connected this and it intersects this line, I'm going to draw a line from this intersection point all the way down here in order to get her calculated absolute VO2 max. So now I have a line across at her age predicted max heart rate, and I have her 2 dots where she reached steady state. And I will now connect these, and I will make it intersect her age predicted max heart rate line. Now I have carried the line down from the intersection point all the way down to the x-axis, and I can now say that Olivia has a VO2, an absolute VO2 max of 3.4 liters per minute at a workload of 1450.
Of their age predicted max heart rate. So in my case, if it were to go over